Hi, good morning everyone. Welcome back to my channel. My name is Satwika and in this video, we'll be talking about the trauma and stressor related disorder. So DSM-5 classified trauma and stressor related disorders into 5 categories. But in this video, we'll be talking about the first two, the reactive attachment disorder and disinhibited social engagement disorder. The first one is the reactive attachment disorder or RAD. Yeah, so this disorder is actually a rare but serious condition in which an infant or young child doesn't establish healthy attachment with parents or caregiver. So this disorder may develop if the child basic needs for comfort, for affection, and nurturing aren't established with the caregiver. So the symptoms of reactive attachment disorder vary from child to child, but according to DSM-5, infant or young children who may have RAD show common signs such as the first one is emotionally withdrawn or inhibited with adult caregiver. So it means that the child are not seeking for comfort from the caregiver. The child also showing no response when comfort is given, and the child also failing to ask for support or assistance from the caregiver. So the child may also often showing avoidance of eye contact or physical touch, or refuse to be hugged by, especially by the caregiver. The second, they also show a persistent social and emotional disturbance. So the children show minimal social and emotional responsiveness, such as failure to show an expected range of emotion when interacting with others. So they often only like watching others closely, but not engaging in social interaction. They failure to reach out when picked up, yeah, or they have no interest in playing peekaboo or other interactive games with adults, even more with the caregiver. And the children also have limited positive effect. So they might look sad, listless appearance, no smile, and etc. Also, the episodes of unexplained of irritability, they might show sadness or fearfulness, even during non-threatening interaction with adult caregivers. Yeah, they also withdrawal or expressing anger, having tantrums, being irritable, disobedience, or even arguing with caregivers, but beyond what would be usual for the child's age and the situation. All right, the third one, the child must be experience extreme insufficient care that might include social neglect and deprivation. This also the unstable attachment as well. It means that the child was like having persistent lack of having basic emotional needs for comfort, stimulation, and affection that is given by the should be given by the caregiving adults. Yeah, they might also living with frequent changes in foster care, yeah, or they're rearing in unusual setting that severely limit opportunities to form selective attachment with the caregiver, for example with institution with high child to caregiver ratios. Okay, and the diagnosis should not meet for autism spectrum disorders, of course, and the onset before 5 years old. So after 5 years old, a kid will not be able to diagnose with this disorder, yeah? And the age of the child must be at least 9 months old. So the prevalence, unfortunately, that the prevalence of RAD is unknown, yeah, no sufficient database research on this disorder. But however, this disorder is rarely seen actually. So children may be more likely to develop RAD if they have had many different foster care providers or spend time in an orphanage, right? Or they were taken away from primary caretakers after forming a healthy bond. Or they have had multiple traumatic causes early in life, such as war survivors. However, the child's developing this kind of disorder is really rare, yeah. So occurring in less than 10% of this um, risky population. All right, so although there's no exact cause, researchers believe that the lack of an appropriate level of loving and consistent caretaking contributes to the development of RAD, okay? So inadequate caregiving can make the child feel abandoned, alone, uncared for, all of which can prevent that child from developing a healthy and secure emotional bond with his or her primary caretakers. All right, and young children from healthy relationship, uh, when their basic needs are consistently attended to, this builds a sense of trust, right, between the young child and the caregivers. But for children developing RAD, this can be established between the child and the caretakers. Example of inappropriate ongoing caretaker situation that place a child at the greater risk of developing RAD include, for example, a baby whose diaper is soiled and not changed for many hours, or the baby is hungry and not fed for many hours, a baby who is crying and not attended to and who is not comfortable when they're in distress, yeah, or baby who is not held, it's not held, touch or talk to, or interact for for many hours at a time, or infant whose needs are met only some of the time, or the caregiving is inconsistent, or the young child who only gains the attention of caretakers by acting up or being disruptive, yeah, or a baby or young child who has had multiple primary caretaker, especially if the care provided is inconsistent, and or from unfamiliar adult. Yeah, so any situation in which the child has been physically or emotionally neglected or abused by primary caretakers or other adults will take this child into at greater risk to develop RAD. However, majority of severely neglected children do not develop this disorder, yeah, but might develop other disorder later in their life. And but to developing RAD is actually rare. And the prognosis of the disorder is depend on the quality of current caregiving environment. So RAD may misdiagnose with autism spectrum disorder because of the similar symptoms of the aberrant social behavior, yeah. However, children with RAD does not show typically symptoms of neurodevelopmental disorders of ASD and intellectual disorders. Also, this disorder should be different from depressive disorder as well. However, RAD or reactive attachment disorder may come together with some of these disorders, including cognitive delays, language delays, severe malnutrition, depressive symptoms. So all of these symptoms may comorbid with RAD because of the severe neglect or the abuse experienced by the children. And the next children diagnosis for trauma and stressor-related disorder is the disinhibited social engagement disorders. So the SED is the same with RAD. It may develop when a child lacks appropriate nurturing and affection from the parents or from the caregiver, right? For any number of reasons, yeah. And as a result of this unfulfilled needs, the child is not closely bonded to parents or caregiver and is as comfortable with strangers as they are with their primary caregivers. So DSED is also known as disinhibited attachment disorder. But according to DSM-5, symptoms of DSED in children may include, the first one is actively approach and interacts with unfamiliar adults. This means that they exhibit no shyness when meeting new people for the first time. They have no fear when approaching and interacting adult strangers. And the behavior that is overly familiar or friendly, both verbal or physical, that makes the children talkative to strangers, hugging or cuddling for unknown adults, that is not consistent with cultural, yeah, and with age appropriate social boundaries, of course. And they also show diminished checking back with adult caregiver after venturing away, even in an unfamiliar setting. They do not look for parents or primary caregiver for permission to approach strangers. And they show no hesitation around strangers, even when departing with an unfamiliar person or strangers. Again, these children experience extreme of insufficient care to be able to be diagnosed with the ESD. So it includes social neglect or deprivation, yeah, the same with RAD. So it's persistent lack of having basic emotional needs for comfort, stimulation, and affection by the caregiver. Also, unstable attachment, for example, frequent changes in foster care, as well as rearing in unusual setting that severely limit opportunities to form selective attachment with adults, for example, in institution with high rates of child to caregiver ratios. And the child has a developmental age of at least 9 months old. So the specifier for the SED is specify if it's persistent. It means that the disorder has been present for more than 12 months, and specify if it's severe, if it exhibit all of the symptoms at relatively high levels. The prevalence of the SED, almost similar with RAD, it's unknown, yeah. And it's rare as well. It's occurring in minority children, even those who have been severely neglected or placed in foster care or raised in an institution is rarely developing this kind of disorder. Yeah, so so the prevalence in high-risk population is only about 20% of high-risk children. Yeah, and it's seen rarely in clinical setting. Okay, so the cause, the risk, and prognostic factors. So unfavorable early caregiving environments can lead to development of these disorders, right? So babies between the age of 6 months and 2 years who have been institutionalized, for instance, abandoned or left in an orphanage after loss of birth parent. They spend time in changing or inconsistent family environments, such as in foster care, or suffer from trauma or severe ongoing emotional and social neglect. They are at a highest risk of developing the SED. Also, most studies of the SED have been done with post-institutionalized and foster children. Again, not all children who have been adopted or fostered develop this kind of attachment disorder. So, but there is indication of neurobiological factors, but no clear link yet here. And the prognosis of this disorder is depend on current caregiving quality. And the differential diagnosis for the SED is attention deficit and hyperactivity disorder, or AGSD. But children with disinhibited social engagement disorder do not show difficulties with attention or hyperactivity as shown in children with ADHD. And this disorder commonly comes together with some of these disorders or conditions, such as conditions associated with neglect, including cognitive delays, language delays, stereotype, yeah, and often diagnosed together with ADHD and DSED. All right, so the treatment for both RAD and DSAD are a psychotherapeutic treatment that includes the child and the family or primary caregivers in the therapeutic setting. So upon an evaluation of the child and family circumstances, an individual treatment plan is then developed, okay? So the treatment here might include expressive therapies such as play therapy or art therapy or dance movement therapy. So basically in an environment that is comfortable for the child to be in a therapeutic setting. So the goal of the treatment is to help the family understand the child diagnosis and strengthen the bond between the child and the primary caregivers, as well as to advance the child's social and emotional development. And finally, that's all for the reactive attachment and disinhibited social engagement disorder. Thank you for your attention, and I'll see you shortly in the next video. Ciao.